Anambra State Health Insurance Scheme was born out of His Excellency Chief Willie Madaburo Chukwuobiano's vision of giving Anambra State what the healthcare outside this climb look like. Universal health coverage, which is by definition a time when at least 90% of any population would have access to quality health care at a very cheap price, is the goal of the entire world. That is Sustainable Development Goal 3. Now, for you to achieve that, the entire world agrees that why the Western world have achieved that is because they had health insurance. A system where people will pool their resources together in a manner that there is financial risk protection. If I bring mine, Mr. Okeke brings his, Mrs. Mbwafo brings hers, there's never a time all of us are going to be sick. If I'm the one who is sick, you take out of the contribution of Okeke and Mbwafo and pay for me. When it is Mbwafo's turn, you take from all of us and pay for her. That concept of pooling of resources for a risk sharing amongst people is what took the West where they are today. His Excellency is widely traveled, to put it very modestly. He had risen through the ranks in the banks, gotten to that very top height of executive director. He was used to having insurance as a rich man, paying peanuts because he has insurance. So for him, it was a case of, if as somebody who was privileged of God to have attained those kind of heights, I'm able to still go to hospital, get the best of care and pay peanuts because I have insurance. Why do I now subject the poor in the society to catastrophic costs when they want to seek health care? And he told himself and everybody in his health team, we must have health insurance. That is the way to go. Let us do the needful, get it to be a social scheme whereby government will highly subsidize it. So he started by making it very formalized. He sent a bill to the House of Assembly that went through all the readings and he signed it. It became a law. Committed 0.5% at least of Anambra State Consolidated Revenue Fund every year to providing subsidy for a scheme. So this is the governor deliberately putting funds to providing health care at an affordable price for the people. And he didn't just do that as a government policy. He had to institutionalize it by making it a law, so that whoever comes after him will have no choice but to continue in that path that he has started. So he has institutionalized a health insurance scheme that any governor of Anambra State who comes tomorrow will have no choice but to commit resources to. So every month since he passed that law and the agency was set up, after all the proper work, from January this year when we set up the scheme, the governor has not defaulted in paying us the Consolidated Revenue Fund 0.5% for us to subsidize health care. That is the reason that whereas at the federal level, the basic minimum package of insurance by the National Health Insurance Scheme goes for 15,000 naira. In Anambra State, we can get health care insurance at 12,000 naira. That is 1,000 naira per month. That's how cheap it can be. It's ridiculously cheap. That at 1,000 naira per month, because His Excellency's government and other governments that will come, because of the framework he has put in place, will provide funds. Somebody who is ill, having needs for antenatal care delivery, whether it's instrumental delivery or surgeries, whether you have appendix and you need appendicectomy, you have hernia, you need herniorrhaphy operation, you need several kinds of surgeries. Somebody is having diabetes, you have hypertension, from diagnosis to treatment. Even if the person will be admitted, in our benefit package, we have allocation to admit people for non-surgical cases for up to 15 days in a year, but for surgical cases for up to 21 days in a year. So you can't beat that at paying 1,000 naira every month. Now, this is what happens outside this country. Healthcare is a big deal anywhere in the world. The NHS in the UK, some persons claim that insurance in some parts of the world is free. It's not free anywhere. It's a highly tax-based system. So they tax everything you do. You have paid indirectly for your insurance, but they're not talking about it. But here this man, Chief Willie Obiano, has made insurance ridiculously cheap. For everybody who resides in Anambra, you pay 12,000 and then you are signed on up on the scheme. We give you a card. You go to any hospital you choose. Over 200 hospitals, whether it's public, it's private, it's mission-based. The big hospitals you can talk about in Anambra State are on our scheme, implementing services to Anambra. As we speak, we have almost 60,000 people enrolled on the scheme. To put it precisely, we have 262 hospitals implementing our scheme. There's no local government in Anambra State that has less than 5 hospitals providing services. As far as Anambra West, you have mission hospitals in Anambra West. In Nzam, which is about the farthest community from Oka, we have 2 hospitals providing services. One of the facilities there, through our adoption model, which I will come to, is managing over 100 lives in a particular hospital in Nzam. I have been there for supervision myself, so I know, yes, that on that monitoring exercise, our standards are being kept. So this has taken healthcare to the doorsteps of our people. The WHO recommendation says 5-kilometer radius, people should have access to healthcare facility. If we have all of these things put in place, His Excellency's vision of having health indices go very high in Anambra would be achieved. And world over, health insurance is the acknowledged vehicle to achieving universal health coverage. So for us, this is unprecedented, and this is to say clearly that the states in Nigeria that have their own subnational health insurance schemes functional as we speak, there are about 5 of them. But then even starting at this stage, Anambra, we kicked off in January fully, and today the story, the success story is everywhere. The testimonies abound. So His Excellency's dream is actually coming to pass. For us, we realized that the National Health Insurance Scheme, I'm sorry I keep making reference to them. This is what they also encourage, that wherever the National Health Insurance Scheme has not done so well, that all the states that are setting up their schemes should learn from their mistakes and correct whatever lapses that the National Health Insurance Scheme have. That's why I keep making references to them. The National Health Insurance Scheme, when they started about 14 years ago, as we speak, about only 5% of Nigerians have been covered with insurance. That goes to say that we haven't done so well with health insurance in Nigeria. The majority of our people are in the informal sector. So, if you continue to focus on the formal sector, like the National Health Insurance Scheme did, you will not get the critical mass of our people signing up. So, the universal health coverage thing will become a mirage. Now, to ensure that universal health coverage does not remain a mere wish, Anambra State here, we had to think out of the box. What can we do differently? And we did critical analysis and realized that in this state, people do their philanthropy in the areas of building churches, building roads, in rural communities, giving people, paying fees for people, paying hospital bills, and what have you. And we have a well-structured socio-cultural institution. In the Anambra, wherever they are in the world, have town unions. They have associations through which they relate with what happens back home. So they come back home to come and organize health outreaches. They spend millions. And this will target the population for only 2-3 days and they are gone. When these people get sick, eventually, where do they go to? They still call the same people who have remitted funds to organize outreaches. So we now looked at it. How do we come in? We brought an innovative approach, which we call the adoption model, whereby we look at every community in Anambra, get those who are the key stakeholders that have influence, traditional rulers, religious leaders, key opinion leaders in the communities, the president generals of town unions. We approach them in an advocacy visit. We speak with them, sell the products to them, and encourage them to reach out to to their illustrious and philanthropic children who reside whether in Anambra or outside Anambra, to begin to tell them to pay health insurance premium for their people back home. So what we now have is, in the adoption model that we have come up with, you see one philanthropist from a particular community will decide to pay for 100 people, others 50 people, 10, 20, as the case may be. As I speak with you, a prominent son of Anambra, who is a philanthropist of note, just paid us money for 1,000 people to be registered in his community. So, such kind of gestures, we go there, we register them in mass. What it has done for us is this. People will come in through the adoption model who couldn't pay ordinarily on their own. Maybe because they didn't have the money, or because they didn't believe in the workability of the scheme. But now someone else has paid for them. The taste of the pudding, they say, is in the eating. When they have benefited from the health insurance scheme, even when the support line from the adoption model ceases, they would have basis to compare their pre-insurance expenditure on health and insurance period expenditure on health. That way they will be encouraged to pay this premium on their own. So we are not afraid of dropouts, because somebody listening to me who is also an expert in the health insurance business will say this is not sustainable. Anambra people have money, putting it modestly, because there is evidence to say that the GDP per capita income of Anambra State is 688,000 naira, comparing it with the national average of 542,000 naira. That says that the ability to pay for services that the Anambra man believes in is higher than what obtains in most parts of Nigeria. Therefore, if you have a way of bringing an Anambra man to test a service, and he's able to say, oh, this is good service, the likelihood of him paying eventually for that service on his own is very high. So for us, the adoption model has worked so far, and we are going to give awards. His Excellency has said he's committed to it. By the end of this year, we will have what we call Anambra Pillars of Health Award, where we are going to appreciate all those who have paid health insurance premium for indigents in the Anambra through our adoption model. And that is to pat their back to say, thank you, you have done very well. And in any case, for the philanthropists, this is a cheaper option for them. One of them, who is planning on signing on 3,000 people into our scheme, told us clearly that what he spends every year on health care is not less than 100 million naira. By signing up 3,000 people through Anambra State Health Insurance Scheme, he will pay 36 million naira to bring them on board for 3,000 people. That saves him about 64 million naira, comparing it with what he used to spend before. And these people can now begin to access this care, benefiting fully from the subsidy that the government is providing through the equity fund that His Excellency has given to us. So for us, it's work in progress, but preliminary results suggest that yes, we are on the right path. We have the federal structure. I like to make comparison with that, where the National Health Insurance Scheme is the regulator, and then healthcare providers render services to the patients, the enrollees. But in between them, there is health maintenance organizations who administer the health insurance on behalf of the National Health Insurance Scheme, who is a regulator. That is some form of bureaucracy. In our own case, the Anambra State Health Insurance Agency is a regulatory agency, yet we are also implementers in the scheme. So we relate directly with the healthcare providers. Now, what good that does to the scheme is this. When enrollees go to hospitals and they have any shortcoming or sharp practices on the part of the healthcare providers, they have access to calling us. We have dedicated phone lines 24 hours. You can reach us from the hospital, and instantly, whoever is on duty in Anambra State Health Insurance Agency, ASHIA, who you reach out to, will respond. We have the mechanism to do that. What we did was, On the enrollee ID card, we have that on the reverse side of it, our 24-hour the hotline is there. People can call us at any time. Because if you cannot, as an enrollee who is purchasing service, have control over the man who is selling the service to you, then the system, there will be chaos in it. So we have done that as a mechanism to put the healthcare providers on their toes. When patients get there and they don't get quality services, they ring us immediately, and we swing into action. We have tried to decentralize our services. We have offices in all the 21 local government headquarters in Anambra State. Not all of them are as functional as some. We have about 8 of them that are extremely functional because of the level of client base from those places for now. But we are optimistic that all of them will be eventually very functional. So what we do is when we get such complaints, we quickly reach out to our officers at those points to go for enforcement on the spot. Now, it will interest you to know that there was a day at about 4:30 p.m. Somebody called from Umunze. A patient had gone there and had the hospital attempting to deny them what was contained in the benefit package. They rang this office, and in less than 10 minutes, our officers were in that location to go and make sure that the hospitals were put on their spot, and they started begging. Before we got there, the patients who had called us to complain had turned around to start appealing that we shouldn't strike them out. But then, we haven't listened to such complaints. Since we started, we have set examples. We have suspended 2 hospitals from our scheme. I mean, this is in 8 months of operations. We've suspended 2 hospitals. We have delisted 1 hospital. Once other healthcare providers hear things like this, they sit up. They know that, you know what, these guys are not here to play. Somebody's vision, His Excellency Chief Willie Obiano, is to give the Anambra quality healthcare service at an affordable price. My job, I say it loud and clear, is to make that happen at any cost, because he's giving us all the support that we need. So we apply sanctions whenever it is necessary without holding anything back. Thank you so much. That question excites me because we started up in January. When we started, that was from ground zero. Up until about March, we were hovering at about 20,000 people who had signed up to our scheme. And at that point, His Excellency, for example, was worried. And I said to him, just like we say in Igbo, let those who have tested the services, let them announce it to others. They will market it. So from that point in March, where we were hovering at about 20,000, as we speak, the numbers are at about 16,000. That tells you the impact of what those who have benefited from the services, the testimonials across the state. So we have a lot of people signing up. One story comes to mind quickly. There is a young lady who, I'm sharing her story because some random journalist had met her and she volunteered to speak with them. I saw the video online. Now, she had cesarean myomectomy. It cost the agency 182,000 naira, but that lady went home paying less than 10,000 naira. And she was fine. She went to her community, announced this. That is at Abatete. And from that community, after that incident, today we have over 200 people signing up to our scheme. The incident happened in April. So that's what one person who goes to testify of the workability of the scheme can do to us. So we are not so much surprised that now a lot of people are signing on to Anambra State Health Insurance Scheme. All we are doing is ensuring that we keep enforcing through regular monitoring to make sure that, yes, our people get the services we have told them that they will get when they go to the different hospitals to go and access care. So that has been the story, and over time, we know that our people are excited about the services they get from the scheme. You can confirm that when you go to town. I can say that without thinking. I will say to you, please don't ask for my input. Go as an undercover, go and ask people in the communities how they have received the scheme. Thank you.